Hello, my name is Maria, and I will be your attending nurse today. What is your name?
Yeah, hi, I am Tanya.
Okay. You seem distressed, Ms. Tanya. Please let me know how I can assist you.
I have an excruciating headache on the right side of my head. It feels like someone has gripped the right side of my neck. I am running a bit late for work and just want a tablet or injection for pain relief.
That's terrible. I hope you don't mind that. I need to ask you a few questions regarding your headaches before prescribing a medication. May I do that?
Sure, go ahead.
So, is the pain on just one side of the head?
That's right, on the right side of the forehead and above the right ear.
And how severe is the pain? On a scale of 1 to 10, how would you rate your pain, with 1 being the lowest and 10 is the worst pain you have ever experienced?
Oh, well, I would rate it at a 10. It's crippling.
That's a pity. That must be really difficult to cope with. Could you tell me if it is a throbbing pain, or a dull or sharp ache?
Well, I would describe it as throbbing.
Okay. Is this the first time, or you have had that before?
No, this is the 3rd week. They come at varied times, almost twice a week.
So, what you are saying is that you started getting these headaches about 3 weeks ago, and you have had at least 2 episodic attacks every week. Is that right?
Yes, that's about right.
And during these episodes, how long did the pain last?
Well, it lasts between 15 minutes to 2 hours, is quite persistent, and pain gets more intense with time.
Alright. Is the pain accompanied by any other problems?
Well, it usually makes me nauseous and dizzy, but only until the time the headache lasts.
Okay. Is there anything that alleviates your pain?
Yes, the pain subsides, with Tylenol or sleeping for 1 to 2 hours.
Okay. Could you tell me if anything exacerbates your pain?
Yes, I have noticed that sunlight from my office window and staring at the computer screen makes the pain much worse. In fact, sometimes it causes ringing in my ears as well.
Okay. Could you tell me about what kind of work you do?
I am the marketing director of my company.
Alright. And how many hours do you work?
Well, that depends. I usually have a 40 to 50 hour work week, but I have been running behind on some project deadlines lately, and that is why I have had to increase my working hours.
Oh, that sounds stressful.
Oh yes, very. In fact, I have not been able to concentrate at work due to the headaches are making me lag behind at work.
Alright. Based on our consultation today, your symptoms are consistent with a migraine. You can see a doctor here in about 30 minutes who will be able to confirm the diagnosis and prescribe some medications.
What do you mean? I just want some medication so that I can get back to work. I have some crucial work commitments today, and all I want from you is some medication to make these headaches go away. I certainly do not have any time to wait. It will simply waste my time.
I understand what you are saying, however, your health is our utmost priority. If you do not seek the right treatment at this stage, you may continue to experience severe pain in the future, which will interfere with your work. Therefore, it is imperative that you consult a doctor today itself, so that he can prescribe the right medication and suggest if any lifestyle modification is required.
Oh Lord, I do not know what to say. I cannot wait for the doctor. Don't you get it? I have an important meeting.
I know, this is a lot to take in. Since you have a stressful job, it is a possibility that stress is triggering the headaches. It's imperative that you get an expert opinion about management of this condition to avoid any adverse effects on your health and work. The diagnosis and the recommended recovery plan will be determined by the doctor only.
But what about my meeting? It is crucial, nurse. I completely understand that. It must be very difficult for you, considering the stage you are in. It must be overwhelming. It's reasonable to feel this way, but I strongly urge you to see the doctor to prevent future episodes, which may be worse than what you have been experiencing. Could you try to get your meeting postponed to sometime later during the day? Well, I suppose I can wait another half hour and get it done.
I am glad to hear that. The doctor will see you in about 30 minutes. I will also give you a patient information leaflet about a migraine, which will explain some of the things I have been talking about. If you have any questions after you read it, just let me know. Is that okay?
Sure, thank you.
Thank you for watching my video. Please subscribe and support my channel.